Before we get started with today's session, I wanted to share, I'm getting a lot of questions from sites on needing some support and education with telehealth billing and coding, particularly with the rural health clinics. So I just wanted to send out a reminder of the education we've done previously. So Marla Dom, who is one of our consultants at BKD, did some really excellent webinars on this particular topic and went really into detail. And then we also worked as part of the Delta program with the BKD consultants to develop those resources as well. And there's hyperlinks on there, and then you can also find them on our website. So I'd encourage anybody to review some of this information that BKD has pulled together for us. And if you need some more help around this particular area, please follow up with me, and I'd be happy to talk to you about some additional support we could maybe provide on that, or maybe do some coaching with Marla as well. So just wanted to send out a reminder about that, because I've been getting a lot of questions from sites, again, of needing some additional support in that area. So today's session is designed to provide all of you with information needed to retain your COVID funding and prepare for a single audit. So our consultants from BKD are going to recommend best practices for procedures, documentation, and example methodologies for tracking various funding resources or sources, revenues, and expenses related to COVID. And during the session, you're going to be provided with updated guidance and recommendations on preparing for single audit, defining lost revenue and expenses, as well as a COVID-19 tracking tool. Since we have our BKD consultants on the line with us today doing this presentation, this is a really good opportunity for everybody to ask any pressing questions that you have on these topics. You have their ears right on here right now, and it's also a great time. Sometimes when other people ask the questions, it triggers thoughts for some of our other facilities that maybe they hadn't thought of that yet. And so it's a really good time for you guys to do some peer sharing and learn from each other as well. So there will be time for discussion and questions. So as we're going along, you can put those in the chat box, you can raise your hand, or you can just make note of what questions or comments you have as we go through the presentation, and then we can talk to those at the end as well. I just wanted to point out too, if there are particular topics that you would like us to focus on or BKD to cover in the upcoming Friday webinars, please reach out and let us know. These are your webinars, and this is a time for all of us to connect on some of these really important pressing issues, and we want to ensure that we're meeting all of the needs that you have and are answering any questions that you have. So our consulting speakers today from BKD are Allie Jackson, Travis Skinner, and Ryan O'Grady. And Eric Rogers is also on the line from BKD, and he will be doing some facilitation. So before I hand it off to Allie, Travis, and Ryan to get started, Cineva is going to pull up a few polling questions.
Thanks, Kate. So I'm going to launch the first polling question. It's a multiple choice, and you should be able to click on the screen whichever answer, and answer to your best of your ability. And once we have those results in, I'll share those with this on the screen. So I'll give you a few seconds, 30 seconds or a little more to answer that question. And then while you're answering this question, I'm going to put a second one into the chat box, and this one is a short answer question, so you can put your response right into that chat box for us. All right, a few more seconds. All right, I'm gonna share the responses to the first poll question. Can you guys all see the screen with the results? Okay. And then in the chat box also, there's a short answer discussion question that you can throw your answer right into the chat box as well. The question is, how are you currently documenting funding, expenses, and lost revenue? All right. I'll let you guys think on that chat box answer, and I will hand it off to Eric to get us started.
Hey, thanks, Senator. So I'll just make a couple of comments on our presenters today. Allie Jackson is a senior manager in our Springfield, Missouri office. And Allie provides consulting and audit services to hospitals and predominantly community health centers across the United States. She's recently moved into our national office practice as well because of her expertise on handling a lot of the single audits. So I thought it would be good for her to kind of chime in and give you the most current up-to-date guidance. We had submitted a slide deck to Kate and Senator last week, and there were some new updates that came out. So Allie made a couple quick adjustments, but she'll give you the most up-to-date information on that. And then we've got Travis Skinner, who's a director in our Waco, Texas office. And Travis focuses almost predominantly on rural hospitals, critical access, sole community, Medicare dependent hospitals. Does a lot of cost report and reimbursement work, work on nursing homes and home office, square footage and 340B efforts. And one of the other main reasons that we thought it would be good to have Travis on the line today is for about a 6-year period, Travis was our firm's leader when it came to the EHR incentive monies that were out there and meeting meaningful use and all of the requirements and the audits that came on the back end after hospitals received a lot of that EHR money. And so in a lot of ways, what we're going through with COVID has got some similarities. And he's going to talk to you about preparing and getting ready for some of those. And then finally, we've got Ryan O'Grady. Ryan is a senior manager in our Springfield, Missouri office, and he works on audits and a lot of consulting work for hospitals across the United States. He does a decent amount of the uniform grant guidance as well. And because of that, Ryan led a team here over the last several months to mobilize efforts to develop a really comprehensive expense and revenue tracker for COVID-specific funds and expenses. So he's going to walk through and answer questions that you've got, and we'll try to help you through, a lot of these financial items as it relates to COVID. So I'm going to go ahead and turn it over to Allie, and each of us are going to take, about 10 minutes or so to cover the most important things that we feel you need to know, and then we'll pause and then give everybody some time to continue to ask questions, have some open dialogue, hear how you're handling things at your hospital, and maybe share some of those ideas and strategies so everybody can benefit from today's session. So Allie, if you wouldn't mind to take your section, that would be great.
Thank you, Eric. All right, so as Eric said, we have had updates within the last week, and we're trying to stay on top of those and just keep checking the HHS website and other resources that we have. But the programs you see listed on this screen here are the programs that, as of earlier this week when I updated the slides on Tuesday, are subject to single audit. So I want you to look at those programs and think about which or how many of those you did receive funding through in the last few months. So I would assume everybody got some provider relief fund, but are there other programs listed here that you also received? If you are billing for COVID testing for the uninsured, although that does feel very much like patient service revenue for you, that is subject to single audit. And so you need to be tracking that as well to be able to report that. So think about these 5 programs that are listed here. I wasn't sure if any of you guys received that last one, COVID testing for the rural health clinics. So I left that included there. Our FQHCs also did get some additional funding through COVID that's not listed here, but that would have been subject to single audit previously anyway. So think about these programs as we go through the next few slides, thinking about they are going to be what is subject to single audit for you and your hospital. There is the bullet point for that second one, the COVID telehealth program. That was actually the one that just updated this week. It is listed on the beta.sam.gov website, which is where we go for just some programmatic information. It's listed as not being subject to single audit, but HHS has informed us that that is an error and it is subject to single audit. So that funding came through the FCC instead of HHS, but that one is listed here as being subject to single audit, even though that doesn't match up exactly with what the beta.sam.gov website says. So the next slide we've got gives us kind of our applicability of who is subject to single audit. And this is going to be any entity, and that would be a state, local government, nonprofits, institutions of higher education. What is not specifically included in the single audit threshold is for-profit entities. But HHS has an exception that they're also going to be subject to some compliance requirements as well for these funds. So a non-federal entity that expends $750,000 or more in federal awards. So thinking back to those 5 programs on the last slide, if you have expended, which would be on either the cash or the accrual basis, you get to select which basis you apply, and you just need to apply that consistently. Most commonly, we're going to see accrual basis. There's not really, it doesn't make it easier to do cash basis necessarily. So think about what lost revenue you have and expenditures to support that lost revenue. And depending on what your fiscal year end is, when you have gone over that $750,000 threshold, combining all of those programs together, that is when you would be subject to single audit. And another point I want to make is right now you probably have received those programs directly, but our states and local governments have also received funding through the Treasury that is subject to single audit. And so you may get funding coming through another entity that is also subject to single audit and would add into that $750,000 threshold as well. So that is kind of the determination, and I'm going to assume that probably everybody on the call has received more than $750,000 at this point, just because of the numbers I've been seeing. But remember to combine everything together when you're looking at that number, and it's based on your fiscal period. So think about if you're a June 30 year in, you may be cutting it a little closer and be able to skate by, but definitely think about your time period and when you hit that $750,000 threshold. Next slide. I have been getting a lot of questions about determining who the entity is. And so I want to spend just a minute here. I've got an example. I won't read through that. You can read that example. But if you are an entity where you have some subsidiaries that consolidate in, you're looking at the entire organization, including those consolidating entities, when you're thinking about that $750,000 threshold. So you have the option to do testing at the more detailed level if that entity has a standalone financial statement audit, but if not, everything's going to be included. So if there's other entities that roll into you, you're going to need to include the funding they've received through these programs as well when trying to determine if you or when you've gone over that $750,000. So we started with a lot of detail about what the programs are and how you determine who a single audit is applicable to. But I'm sure you're asking, like, what is a single audit? And that first polling question, most everybody got that accurate. A single audit really is exactly like it says. It's a single audit. So they created the single audit. We can go to the next slide, Seneva, to really eliminate, there was just a lot of diversity in practice in the different compliance audits. And really it gets all the federal agencies on board with one single audit. So it's an audit of your financial statements, and there's an opinion on the schedule of expenditures of federal awards, which you may get here called the CFA. That is all relating to the single audit from more of your financial statement and the financial perspective, but then there also is the opinions on the compliance as well. So internal control over financial reporting, and then the internal control over compliance and compliance with whatever those programs are. So really a single audit, if you're thinking about if you're used to just having a financial statement audit, it is that, plus we're auditing to make sure that you've managed and controlled and used those federal funds you've received appropriately. So that's the goal of a single audit. You can do those two parts separately, which I think we will have health systems who have to get to that place where they go ahead and do the financial statement audit and kind of come back and pick up the compliance a little bit later, just because honestly, we don't have guidance from HHS right now of how those programs are going to be audited. We're still waiting for that and don't expect it's going to come very soon. So we're going to have to decide whether we go ahead and do financial statement audits and then come back and pick up the compliance audits a little bit later. But that is what a single audit is. It is eliminating the different agencies' specific requirements and kind of putting it all into one single audit process. On the next slide, I've recapped some of your responsibilities as an auditee. I won't spend a whole lot of time on some of these, but the first one, the financial management system, that is that you have adequate tracking. One question I get asked often is, do we need to be tracking the funding and the expenses in our GL? And technically, you do need to be able to run, like from your accounting system, a recap of revenue and expenses for each of your federal programs to show that you're not making revenue on those programs. Your revenue needs to match your expenses. So that's a component that some who haven't had single audits before don't know about. Internal controls, you guys are used to internal controls on your financial statement, so it's just also internal controls over your awards that you're receiving. And based on watching the answers come in on the chat, you guys do have, you've developed some controls of tracking. You just need to make sure that those are getting reviewed to prevent and identify any issues. Other auditee responsibilities, you're responsible for securing the audit, for planning that audit, of hiring an auditor. The goal of, in uniform guidance, the goal of an audit, a single audit, is that it's a high quality audit when you go hire your auditor. So keep that in mind. You're also responsible for preparing your financial statements, and that CFA I mentioned, that's just the schedule recapping all of the federal awards you've received and expended. Then obviously providing access, you're used to that in an audit anyways. And then the last two items are specific to the single audit. You are required, if there are any reportable findings, you are required to take corrective action on those and document what your corrective action is. And then the following year, you will have to report how you did correcting those issues. And then the last one is that your single audit has to be submitted to the Federal Audit Clearinghouse within the earlier of 9 months of year end or 30 days of completing that audit. And with that submission, that makes your audit report a public document. So that is one thing that you also may not be accustomed to, is anybody can go online and search for your audit report and see your financials and your audit report. On the next slide, I have just some of the generic compliance requirements, but this is the question we get all the time is, what are you going to test? And I already said, we don't really know right now. We are waiting for guidance from HHS, and we are expecting that guidance is going to come through a compliance supplement addendum later in the fall. So we don't really know exactly what that testing is going to look like yet, but some things to be very mindful of just from other programs that we expect to apply here. Cost principles, it is in the FAQs for like the Provider Relief Fund that you cannot use those funds for expenses that have already been covered by another program. So the Paycheck Protection Program loans, any other funds that you receive that are coming from the federal government, you need to make sure that you're only paying for those once with federal funds. And so that's something to be watching out for. Definitely, it's addressed in the terms and conditions. Cash management is probably not as big of a deal with the provider relief fund because they put that money in your bank account without you necessarily asking for it. But normally you are supposed to be minimizing the time between when you receive the funds and when you disperse those funds out to your vendors or your employees for payroll cost. So that's another one that people get tripped up on often. And then the third one, procurement. This is something where if you are using any non-employee, so if it's non-payroll expenses and even your benefits count here, if you're using a vendor, you need to make sure that you're following your procurement guidelines in your policies and procedures. And actually, those procurement guidelines most likely are not compliant with what uniform guidance sets. There's some thresholds in uniform guidance and different levels that you need to do in terms of sending purchases out for bid to secure vendors. And so that is something that most likely you will need to go in and update your policies and procedures to make sure that they are compliant with uniform guidance, and then make sure that the expenditures you're charging to these grants are following your procurement policies. Last slide, I just have some tips. I think one of the biggest things is gathering that information to be able to present that to your auditor. You need to have split out by the different programs because they're going to have to report it like that on the CFA in your audit report. I mentioned the procurement policy and procedure. You actually need written policies and procedures to discuss how you're determining what costs are allowable for federal programs. Your that cash management compliance requirement requires a written policy and procedure as well as the procurement. So making sure that your written policies and procedures are up to par is going to be crucial. And then just start having the conversations with your auditor to make sure you're both on the same page. I have a link here for a webinar we did. If you do need some more information, it's your first single audit. We did a webinar earlier this week on Tuesday, and we're going to do an encore on Wednesday morning next week. That is an hour of just preparing for your first single audit. It gets into some more detail of what I've covered so far this morning, but I wanted to kind of give you guys the high level and specific for what you've received so far. So do we have any questions?
There, Kara Jo had a question that she put into the chat box. We have a procurement policy, but it likely needs to be updated. Does BKD have any sample policies that could be shared to be in compliance with the uniform guidance?
I will check into that. I have seen some samples, but I will look into that and get that to Eric and Cineva.
Well, Allie, appreciate you sharing some of those insights. Again, if you still have other questions that kind of come up over the next 30 minutes as we're going through, go ahead and put those in the chat box, and Allie can be looking through those as well. But for the sake of time, I do want to move on to Travis, because this is kind of the next logical question is, hey, if we're going to have to be testing and tracking all this, I mean, how do we define it? So Travis, if you wouldn't mind to kind of walk us through, we'd appreciate it.
Thank you, Eric. So good morning, everyone. I hope everyone is all right and have been well and staying safe in these crazy times. And like Allie said, it's great. All this stimulus funding is out there in the healthcare universe now. However, the strings are slowly starting to get tighter on having to report on what the funds are being used for. And if you've been in healthcare long enough, you already know when dealing with the government and healthcare funding, how the rules of the game can just change well after the fact. But for right now, we can't worry too much about that. And we're going to quickly focus on what we can control and what we know as of today. And as Eric said, as what happened with EHR, their documentation is the name of the game. So based on the terms and conditions associated with all the distributions, provide an expectation on how the funds were to be used. And in those terms and conditions, the recipient recertifies that the payment will only be used to prevent, prepare for, and respond to coronavirus. You're going to hear us say that a lot. and that the payment shall reimburse the recipient only for healthcare related expenses or lost revenues that are attributable to coronavirus. Now, every TIN number, because that's how the money was distributed, so every TIN number that received payments under the Provider Relief Fund will be required to comply with the terms and conditions. So for example, if your TIN number received $2 million from the first $30 billion tranche, but you own nursing homes and you distributed $500,000 to 5 of your nursing homes, then your facility would have to report on the $1.5 million that it had for itself, as well as the $500,000 for the nursing homes. So you'd have to make sure your nursing homes are following those same terms and conditions and reporting guidelines. And that's just an example of that we find commonly through Texas, at least with the nursing homes, but that could be any entity. HHS expects that providers are to only use the funds for as long as they have eligible expenses or lost revenue. And if at the end of the pandemic, whenever that is deemed to be, no one has an end date in mind, as far as we know, providers with any leftover money that they can't spend on allowable expenses or losses will have to return that to HHS, which we all hope doesn't happen. Another exciting part to this is that the Provider Relief Fund participants in the future, that HHS can audit all of this in the future and collect any funds that were deemed to be used inappropriately. So we can feel safe that we have more audits coming. But let's get to the first side, and let's get into some of these expenses and revenues. So payments should be categorized in one of the two following places: either healthcare related expenses attributable to COVID-19, or to cover costs that lost revenues attributable to coronavirus would have covered and that are attributable to COVID-19. So again, the terms and conditions state over and over again that these should be only used to prevent, prepare for, and respond to coronavirus. But that could turn out to be a very wide open and gray area. So if providers have eligible healthcare related expenses, which you can see listed on your screen, this comes out of an FAQ that came out on June 2nd, but actually has been modified up on June 19th, but it didn't affect the expenses report. That if you have any expenses attributable to coronavirus prior to the date on which they received payment, they can use that payment for such expenses incurred on that date. So as long as those expenses were attributed to coronavirus and were used to prevent, prepare for, and respond to coronavirus, then you can use the money for that. And HHS doesn't anticipate providers having expenses prior to January of 2020. So from January 1st of this year forward is when we can look for those expenses. So the listing, this listing that you see is from that FAQ, and by no means is it an all-inclusive list. I'm not going to go into those in detail. There are many other costs that may be allowed by HHS under these definitions, which we have other potential examples for each of these categories. So you can see they left it very vague, especially in that last bullet point of acquiring additional resources, including facilities, equipment, supplies, healthcare practices, staffing, and technology to expand and preserve delivery care. So what we've been looking at is kind of the intent of this. If everybody in your county showed up at your hospital today due to an outbreak, are you prepared for them to be there? That's what this money's for, is to help prevent that, prepare for that, and to respond to it. So if a provider believes, a cost meets the definitions given, they should ensure that the appropriate support is maintained to document their determination. That could be invoices, statements, contracts, other support for the amount of the expense, also including a narrative as to how the expense meets the provisions. And that one is very important. No one wants to be under audit 18 months from now, if not longer, either having to remember what everyone was thinking back 18 months ago or worse, having one person assigned to these funds and that one person possessing all of the knowledge of what was happening with those funds. And all of a sudden that person gets made an offer, that they can't refuse, and they leave your facility. now your black box of information is left with them, and you're left rummaging through network files, old emails, and what's left in their office space to figure out what was going on with our grant funding and what we're using it for. So the narratives of each one of your expenses and lost revenues are imperative through this process. And that includes anything that what Ryan is going to speak on later about our innovative tool with the BKD Track Forward. Anything that goes on there needs to have a narrative of explaining what the thought process was. Because as with real estate, it's all about location, location, location. As was EHR and provider relief reporting, it's going to be all about documentation, documentation, documentation. Especially if your funds can go through, as Ali went through, a single audit. There's still the HHS reporting that would need to be done, and the subsequent audits that HHS can do. So this isn't over with a one-time shot at all. And the same goes for your lost revenues. And this is the first time, I think, in healthcare, so I've been told that lost revenue will be included. So everyone is still kind of learning as we go with this, but for right now, this is what the FAQs have told us about the lost revenues. And like I mentioned, the June 2nd FAQ released by HHS, it attempted to provide clarity on this subject and has been modified since on June 19th. But according to HHS, the term lost revenues that are attributable to coronavirus means any revenue that you as a healthcare provider lost due to coronavirus. Now, they've also provided very limited guidance on acceptable methodologies for providers to calculate lost revenue, which this is the only modification they made on this FAQ in June 19. And to quote it, it says, you may use any reasonable method of estimating the revenue during March and April of 2020 compared to the same period had COVID-19 not appeared. For example, if you have a budget prepared without taking into account the impact of COVID-19, the estimated lost revenue could be the difference between your budgeted revenue and actual revenue. It would be also reasonable to compare the revenues to the same period last year. That's kind of what we knew, comparing budget to actual, comparing prior year to current year. Providers should probably consider multiple different methods as well, so they're prepared when additional guidance is released. It would be reasonable for a provider to compare historical revenues to actual, like the FAQ said, but based on the information that we have now, it would appear a reasonable method of estimating lost revenues would be to evaluate the decrease in visits and or procedures or the increase in uncompensated care as a result of the coronavirus. Providers should also consider lost revenues at a macro level or entity level, as well as the micro level by location, by department, by statistical measure for declines in surgeries or procedures or visits. So there's a wide array of gray area that we can get into that, as long as you're consistent and you document it and you have a narrative with it, that's right now the best case or best practices. You should also, well, they haven't really provided guidance on an acceptable baseline, but using baselines to compare actual results during the pandemic. Take, for example, if you have a new service line where there may not be historical data to estimate lost revenues. A comparison of budgeted revenues or encounters might work. You might also want to think about using several different baseline periods for the organization to consider its lost revenue calculation, like using an average monthly revenue for the trailing 6 to 12 months, or average encounters and surgeries over that same baseline period. But we suggest considering multiple different periods to ensure a thorough analysis to make sure we're taking the best case scenario. Like we already said, lost revenue is a new concept. So here's some other food for thought for the providers just to think about as you're getting this lost revenue, because you have to have expenses with that as well, like as Ali said. So providers should review other possible impacts to their revenue stream, such as reimbursement or turnover of providers that may have impacted their revenues. Those two might not be attributable to COVID-19. You'd have to really look into those to make sure what caused those impacts. Second, it would, important, we can't stress enough, do not double dip from this. That means do not double dip from other funds like the PPP loan expenses that you'll have to use there, or any other fund that you receive, as well as the expenses that you'll use in the CARES Act or provider relief funding as well. For example, if you estimate that your facility lost $2 million due to canceled elective procedures, but had $1 million increase in uncompensated care due to the coronavirus, you'd have to document and support and have a narrative that the increase in your uncompensated care is not included and accounted for in the lost revenue of your elective procedures. So they don't overlap. So we can't double dip. And again, on the next slide, you'll see this. This is not an all-encompassing list of how to estimate your lost revenues. That's something that needs to be discussed and thought through and worked through. So definitely need to have people involved with that. Like I said, it's still a relatively new process. So in closing, we can't stress this enough, and regardless of expense or revenue or estimation methodology, as Ali said, these funds are subject to a single audit, reporting to HHS as well. And then they could be audited subsequent to all of that. So whatever method is chosen, it has to be backed up by supportable evidence. It has to be documented. Documentation, documentation, documentation. So with that being said, Eric, I think we're about ready to see that nice tool.
Yeah, I do have one question for you, Travis. So I was on we were on a call similar to this last week with another group of hospitals, and we had a really good question come up from a CFO up in Vermont. It's a hospital that we do audit work for and other cost report work. Really strong CFO, but Vermont as a state handles things a little bit differently. And the state came out with guidance that said that, when you're calculating these lost revenues at the organization, we want you to net that against some of your decreased costs. So if we know our volumes have come way down, we've lost all this revenue, but yet we've not had to buy as many supplies and our staffing is down and our costs are way down as well. Do we have to net that? Have you heard anything in other states, or curious to get feedback from the people that are on the call today? Are your states making any comments about netting some of these items?
No, Eric, I have not heard that. Now, in the FAQ, it does go in to explain that if you had lost revenues with elective procedures, that you have to have the expenses with that they're looking for. And if you read through that, I know a lot of people have read through that and it gets very confusing. But as far as state specific, no, sir, I have not heard that at all.
Okay. The last one I'll ask you, then I'll turn it over to Ryan. People are going to take different stances on what they want to consider, a justifiable expense to the organization. Here's one that came up last week. We had a small hospital that said, we're comfortable as an organization buying a new boiler. And they were also talking about their chiller as well, that were like from the 1960s. Extremely old equipment. They feel like, hey, we have to have this equipment to continue to provide patient care, whether it's a COVID patient or not. We have to have this equipment. We've been putting it off and off because we can't afford it. It's a $750,000 expense. Is this the time for us to pull the trigger on that new boiler, chiller, major capital expenses like this? So not asking you to give a yes or no, but any thoughts to that?
Yes, sir. And like I said, with that gray area, this is where you can get, I hate to say imaginative, but you have to think outside the box with this in some cases. If we can go to the slide previous to the revenue slide here, and there is, and we've heard this for other facilities, that if normal course of business, if we didn't have the influx of COVID patients because we had an outbreak, our system would be fine and we'd be running good for the next 3-4 years. But if it comes in, especially in Texas, we've heard it with the chillers and the air conditioners, we have old equipment. And if everybody in our county showed up in Texas and we had to run, especially since it's 110 today, I think, if we had to, everybody showed up in our ER wanting to be tested for COVID and we had to run our AC unit at full blast to try to keep, all these hundreds of people cool, it's going to blow up. It's done. And then we're shot for the rest of the time. So you could look at that as part of the preventing and preparing for a COVID outbreak. You absolutely could. Acquiring additional resources, including equipment, to expand or preserve care of delivery. That's pretty, to me, that's leaving the gate open and letting all the cows out. But it's very vague. It is up for discussion. And again, you would, if you did it in March and you don't get audited for 2 years down the road, having a narrative to explain your exact way of thinking on what your process was, how you decided it met and prevented and prepared for, all of that information, that's the best way to go.
All right. Thanks, Travis. And, you know, we think about the air handling systems and keeping negative pressure rooms running. A lot of that stuff's interconnected, so it can get very difficult. Documenting your thought process and rationale will be important. Thank you. Appreciate it. Ryan, you know, we've got about 10, 15 minutes here. I'd like for you to kind of walk through some practical examples of some of the tracking tools that you and your team have developed to help the hospitals really do a top-notch job and feel solid going in and being ready for these audits that are going to come.
Definitely. Thanks for having me. And Cineva, you can jump forward a couple slides, I think. Yeah, one more. So, you know, as Travis and Allie talked about, you know, we've developed a tool to try and help support the expenses and lost revenues and all the other support that's going to be necessary for your single audit. Gather all of that information into one area, one tool, so that you can continually monitor the progress that you've made towards supporting those funds and then being ready to respond to HHS quarterly reporting or any other reporting that they have for you. And then when your single audit comes, having all of that support ready at the really at the tips of your fingers, and then potentially into, you know, other site visit HHS audits that could happen in the future as well. So I'll jump into that tool here in just a second, but, you know, something we haven't talked about yet that, you know, Allie mentioned, we don't know all of the reporting requirements that are going to be necessary or compliance requirements that we're going to test. But I think being able to validate the funds that you received and that you were actually, that what you received is what you were owed or you know, responsible for. So, you know, being able to reconcile back to the general distributions that you received, you know, having the support of your 990, that, you know, 2% of that 990 is what you received. If you received any targeted distributions, you know, being able to support to your auditor that you actually qualified for that targeted distribution, and here's the calculation that we provided, here's the backup support to support that. I have a feeling that that might be part of that single audit, or at least if HHS comes out and we have parts of our tool that help with that. And then developing policies and procedures that both Travis and Allie talked about. And then kind of getting into the tool, you know, identifying and tracking the expenses, supporting your lost revenue calculations, getting that all in one place so that you can quickly respond to reporting mechanisms. Whether that's from HHS or just supporting your single audit. So that's kind of how we thought about the tool when we were developing something, and kind of the certain aspects of it that we're trying to hit to make sure you know, it's useful to the users. So next slide, I can kind of show you guys. This is an overview of kind of the main menu tab of the tool. We're tracking, you know, we're trying to track getting a repository of all the different funding that you've received. So this tool can track all of the CARES Act distributions, Medicare accelerated payments, and kind of tracking that recoupment period after those 120 days, documenting your expenses, your payroll costs, your capital costs. And then also there's a few different tabs to help with lost revenue calculations, both from kind of the couple different perspectives that Travis talked about, the macro level calculation, and then more of a micro statistical basis calculation. And I'll jump in to show you what some of that looks like. But also, we also have kind of what I just talked about on reconciling the payments that you received to kind of some of that backup support to show that you actually qualified for that funding. and to support the amount that you receive. So all of those are kind of the important aspects of what our tool can help do. You know, it is kind of a repository of your data. So like Travis mentioned, tracking of expenses, and I think in our chat bar, you guys have kind of had a few people talk about what they were doing, and I think a lot of that sounds good, that you're trying to capture expenses at the purchase, you know, at the start of it, at the purchase order level, getting those coded into your general ledger, so that you can run those reports like Ali mentioned to support the revenue you've recognized. I would say, just because it's hit your general ledger, somebody's coded to that, it does still need to go through a review process internally, kind of those internal controls that Ali mentioned too. So just because you've coded it to your COVID department, I think there still needs to be some time spent that, you know, looking at the invoices and gathering that narrative documentation to say why that cost helped you respond to, prepare, all that stuff that Travis laid out there. I don't remember the exact 3 words, but Travis was pretty good at it. So, you know, we can hop off to the next slide, but a lot of this stuff that you'll see here, it is customizable. We kind of have I have some just general information laid out, but if you have different funding sources, maybe you're receiving other federal, state, or local grants to help with your COVID response, you can track all of those grant funding sources, not just the CARES Act distributions that everybody's been receiving. So there, you know, you can really, that kind of helps to make sure you're not double dipping. So you're allocating your expenses to those funding sources and then the CARES Act funding. So this tab specifically is where we're kind of accumulating all the different funding sources that we've received. And this is maybe the most important tab of the whole tool, because if you don't list out the funds that you have, you know, tracking them on the expense side or the revenue side, you know, it's not all going to flow together. So getting a good repository of everything you've received, reviewing and documenting that you've attested to the terms and conditions. We've kind of, I know you've probably gone online and attested for that already. You might have the email support that you've done that, but we've kind of developed this as a way for you to document all in one place right next to the funding that you've recapped here. Who did that, when it was happened, and maybe where you've saved that email email confirmation at on your network or whatever, so you can quickly respond to the auditors or keep a status of what you have left to do. So we can kind of jump over to the next slide, and I'll talk a little bit about expenses and what we have here. I hope the screenshots are showing up okay for you and not too blurry, but as we've talked about, it's really important to be coding your costs to your general ledger so that you can then separately identify those and start reviewing them. And so even with any tool, whether that's the tool we've developed or if you're tracking those internally in an Excel spreadsheet, the coding in your general ledger, it needs to happen regardless. That's kind of how you get your population of expenses. And then when you have that is when you're going to move that over into this tool or any tracking mechanism that you're using. So, you know, we've kind of built this to lay out some of the information that we think is going to be necessary in your single audit from a documentation perspective. So what type of expense it was, your invoice information, your general ledger, where it's at in your general ledger, when the costs were paid, and you know, time back even to the check number, what vendor, and then most importantly, kind of what funding source you've identified the use of this funds for, so that you can kind of systematically go through and allocate that funding to your funding source, so you're not double dipping with extra expenses. So that's kind of that recap. We'll hop over to the next tab. I think we've got payroll here, which that looks a little small. I apologize about that. But I think the most important thing on payroll is when I'm kind of doing demos, talking to people across the country about what everybody's doing, sometimes I hear that, you know, in our payroll system, we're coding some time to a COVID department, and it's just automatically hitting our general ledger, and that is good. That's how you kind of identify those expenses, and you track it that way. However, you do need to pay attention to the actual individual whose time is getting coded to that, because in the terms and conditions, it does talk about a salary limitation for each individual that has some of their salary charged to a federal program. The dollar amount is $197,300 for this year. That changes every year, I think around September. So if the funding does move out past September, you do want to be careful for when that rate changes, but you really need to look at that on a pro rata basis if they are over that threshold. So if you're maybe some executive level individuals or providers are maybe putting a portion of their time to COVID, you need to track, if it's 10% of their time, it's actually 10% of that salary limit is your max that you can charge for that. So it's kind of on maybe an FTE basis. So just because you only coded $10,000 of somebody's salary when they made $1 million, you might not think you're over that limit, but you might be, because you really need to factor in that dollar amount on a pro rata basis. And our tool helps do that. It tracks it at an employee level, and it's really meant to just track the employees you've identified that need to that are being charged to COVID. It's really not meant to house your entire payroll register every pay period, because that would be pretty cumbersome. But you lay out their wages and identify the funding source that they're going to, and it'll calculate to make sure you're not over that maximum threshold. And if you need to allocate to multiple funding programs, it'll allow for that as well. And you can kind of see a red highlight there. It has some conditional formatting to make sure you don't over allocate by over 100% somebody's salary, just as a catch-all. So that's important too. We can kind of hop over to the next slide. We've got kind of one look at lost revenue. I think I showed you kind of our micro analysis here. I don't think we're going to show the macro, but you guys can get an idea of what that looks like. We've kind of set this up to track, for each department, various different statistics that you might want to look at. And again, all of this is very customizable. We kind of have some statistics that we think you might want to look at, but certainly there's kind of a portion of this tool where you can go in and modify whatever you want to look at. But you'd put in kind of your baseline amounts there, and use your ranges, whether or not that's a trailing 12 months, trailing 6 months, if you want to look at same month last year and compare, or comparing to budget. All of that can be done in this tool and easily documented. So you want to, like Travis mentioned, we'd like for more guidance to come out with related to what HHS is expecting on lost revenue documentation. So continually monitoring the FAQs that he talked about and making sure you're up to date with, any potential changes, and making sure you're in line with what those expectations are. But for now, I think what we're trying to tell everybody, and what we think our tool helps you do, is looking at things a variety of different ways, slicing and dicing kind of different ranges, different time periods to look at, factoring in some of those maybe decreases in reimbursement, or maybe provider turnover that may have happened in this baseline period that you're looking at. Well, when you're comparing to March of this year, there might be a reason that there's some lost revenue. Maybe a doctor left during that baseline period. And so, you need, or after that baseline period, you need to take out some of their encounters to really be comparative to what you would have expected in March of this year. It might not be a 1-for-1 of, this is what we had last March, so this is what we should get this March. There are some factors I think that need to be considered at least, and putting those thoughts and how you arrived at your conclusion on lost revenue, I think in a memo, in a policy, or just, some sort of documentation is going to be necessary to help explain kind of and support your ultimate conclusion. Because I think it's going to be on a you know, every organization is going to have a reason for doing it a little different. So supporting how you've come to your conclusion is going to be really important. We can hop over to the next slide. Yeah, one last one, I think, where it kind of just recaps everything for you. So here's where you're putting your funding sources, and it's pulling in payroll, benefits, costs, all of your lost revenue, so that you can quickly compare to the funding that you've received that you also inputted, so you know how much more you need to support, or if you've kind of allocated enough for that funding source, you know, you can kind of pay attention to the other funding sources as well. So this kind of helps give you a good level summary, and then probably quickly respond to some of the reporting requirements that you might have. So feel free to reach out to me. I can go through a lot more detailed of a kind of one-on-one demo if you guys are interested with that. Sineva might have my contact information, or you can go to bkd.com and request a demo as well. So
Thanks, Ryan. Really appreciate that. We're out of time. I can stick on a little bit longer. If there are specific questions, Sineva, I don't know if people want to raise their hand or just type it in the chat or come off mute. Either way, happy to field a couple questions. For the BKD people on, if you do need to leave, feel free. I'll try to field some questions, and if I don't know them, I can relay those to the right people. So, any questions out there?
As people are thinking of if they've got questions they want to ask, I think Simba had another polling question to pull up too.
Hopefully this was beneficial and helpful for everybody. I know we're trying to cover a lot of ground in a short time, and that's kind of why when I was talking with Kate and Sineva, we thought that it'd be good to kind of spread this out over multiple weeks. The topics are out there, and so if you're interested in a particular topic, like on the operations day when we talk about staffing, you know, feel free to identify the week that you think is going to make the most sense for you and your team there. You know, next week we're going to be covering the SBA and PPP loans and the tracking of those. We've got an expert in our Kansas City office going to be talking about business interruption. We're going to talk about new provider relief funds, the Medicaid and CHIP. I think the deadline for that is coming up in 3 days on 7/20. So that one may be a little late, and then safety net hospitals. And then we're also going to be talking about our cost report implications as well. So be looking out each week at those topics, pulling in the right people in your organization. Kate, what other thoughts do you have?
I think Sineva just said the final slide was a reminder of the upcoming webinars, and thank you for addressing the one for next week. I saw Paul had a question on that, so he knew who to get the right person on. And I just wanted to reiterate to reach out to myself or Eric if you have something really specific that you would like covered in these webinars, so that we can make sure that we're meeting your needs and answering any pressing questions that you have right now. And that's it from my end. So thank you all for joining us today. Really appreciate it. And thank you for the expertise too from the BKD team.
Happy to help and look forward to next week.
Yeah, everybody have a good weekend.
Thank you.
thank you.
Thank you.
Thank you.